So, what makes a plastic surgeon qualified to do a labiaplasty versus a patient going to see a gynecologist, a urologist, or a urogynecologist?
Oftentimes although those surgeons work with like women like a gynecologist, they don't have training in labiaplasty. So plastic surgeons sort of pioneered the surgery. We talk about it at conferences. There's tons of educational resources for plastic surgeons about the procedure. There's a couple different ways of doing it. Whereas oftentimes when you go see an OBGYN, they will tell you it's a variation of normal and not to worry about it. Even I've taken care of patients who had tears in their labia, and the GYN said not to worry about it. And I'm like, well, I mean, that's it seems like that would have been a slam dunk to correct. But since it's not really in their wheelhouse, they don't offer it, they don't talk about it. So I think that makes us more qualified to address it.
And is there any reason that you would send a patient to go see a specialist for this procedure?
For straightforward labiaplasty, no. I've seen there's a category, a very, very, very small category of women who've had genital mutilation performed elsewhere, usually out of the country. That's somebody who needs to see a specialist for reconstructive purposes. I mean, because we do our consults together, I always start the consult with an exam because I don't want to have a whole conversation about labiaplasty if the patient's understanding of anatomy is different and they're talking about something completely different. So I've had a few patients that came in with fairly normal anatomy and their concern was more deep seated or psychological, and we've referred them back out. Like, this is not going to solve, issues with orgasm or pain with sex or any of those things. And then the labia itself is the outer area of the vagina. I don't personally do vaginal tightening. That I would refer to an OBGYN that does that. And so if a patient comes in with concerns about that, then we usually refer them out for that procedure or do it as a combined case too.
Right.